Good morning, good evening, good afternoon. Dr. Pablo here. Sunday, February the 2nd, 2020. The first webinar for the year. We have been busy, let me tell you. Let me sip my coffee. Wait for a few more people to log in. Today's an introduction to the year's event. So we've pre-booked in 10 webinars for the year. They'll be done over the next 3 to 4 months. Some of you will need to not wait for the webinar. You'll need help sooner than that. Don't hesitate to get in touch with us. At the end of this video and below the video is all of our contact details. So don't be shy. I book in more than an hour, between 1 and 2 hours, to do consultations with you online. So you can evaluate us and we can evaluate you. And that's really important. You need to find somebody who's going to fight for you, who that you connect to, that you feel comfortable with, and that's part of that process of us deciding, are you a person we can work with? Because we have new clients arriving here every 3 weeks and clients leaving every 3 weeks. So there's two things we're evaluating. Are we a fit? And are you comfortable to getting in along with other clients that are here, because everybody's comfort is really important, really important. In 20 years, we've seen some good, the bad, and the ugly, and so we've learned a lot. It's not only important that you combine the right therapies for your type of cancer and you apply them in the right stages. It's also important that the environment is fun and full of laughter. So today I'm going to share some testimonials with you, some recent, but one that's I going back 15 years, so a very long and old testimonial that is, often I get asked, why do I do this, and where did I start, and so on. And so let me just start the year with a little introduction about me. I started here back in the year 2000. In around 1995, I had a vision, and in the year 2000, I started on this journey. I fell into this industry, running, and loved it. I loved what I learned. I loved the results. There's nothing more powerful than teaching somebody, giving somebody the tools that's been sent home to die, and having the amazing result of seeing them become well. Sadly, it doesn't happen in all the cases, and that's frustrating. And that's why we don't only do one thing, because back then we did. Now we apply 10 different therapies, of which 5 are the most powerful therapies in the world. And the cancers that the traditional system has problems with, our facility has the best results, and I'm talking bone cancer, metastasized breast cancer. Of course, primary is fine, but when the cancer is metastasized, it's a problem. And so 20 years, the reason I'm still here, because this is a challenging job that I love with all my heart, but it's hard sometimes, you know. Some people don't make it, and we fall in love with them. And so other places don't tell you that, but it's the truth. And so I start the year off with a thank you to all of my past clients that keep emailing me and say, hurry up, we need another webinar. There is so many hours in the day, and you know, I have a dozen doctors that I help that are calling for advice, and I guide them. I have doctors in my facility that I'm training and teaching, and I hope this year that we take the spa to a new level. As I've been speaking to you about for quite a few years, we are working behind the scene on some exciting and fantastic things. We've also, in addition to cancer, today the cancer subjects, I'm going to cover broadly all the different cancer types, and when they come up, feel free to write your questions. If you have questions beforehand, just write them anyway, and I'll answer them when I get to that point, if not at the end. The video will be about an hour, And you might say, oh, do I have to listen to this guy for an hour? Let me tell you, if you're baking a cake and you miss one ingredient, baking soda, it's going to be a not nice cake. If you miss the sugar, it's not going to be a nice cake. If you miss the flour, I don't know what you're going to end up with, maybe an omelette. One ingredient is important. And you've heard me say this so many times. If you've got a car and somebody steals a $1.50, $2 spark plug out of it, doesn't matter whether it's a $25,000 car or a $150,000 car. It's not going to go anywhere. That little item is really important. So invest the time in learning. Spend the time on this webinar. It may answer the questions. It may not. But it may give you that one important thing that makes a difference between you making it and you not making it. And I think that's priceless. And that's what you should be listening for. You should have paper, you should have pen, you should be making notes. And the most important thing is whether you're working with me or one of our friendly doctors, it's important that this webinar will give you the opportunity to think of the correct questions. Because when people ring me the first time, the questions are not relevant. They're asking me things that are not relevant because they really don't know what to ask, because they don't know about alternative therapies. So sit back, relax, watch this on your TV, get the family around. All of you write down questions, because there are no stupid questions. They're all important. And the more you ask, the better. And I'll answer everyone as best as I can and help you find the path to wellness. Okay, so I guess a few people have logged on. Thank you for the thumbs up and the love. So a little introduction of the... Oh, I was going to tell you about me, why I started on this first. Sorry. Okay, so my brother-in-law, Joe Koninski, boxer, champion, absolute machine athlete, going back 20 years ago now, was suddenly became ill and was rushed to hospital, and they sent him home, couldn't find a problem. He got worse and worse, like went downhill quickly. And so then they done some more tests and discovered that he had cancer. He had a most unusual cancer in that all of the muscles that surround his stomach area, all of them had turned into cancer, and it basically looked like muscle, and it couldn't be recognized as a cancer until they went inside. So terrible news for him. Anyway, we heard about vitamin B17, and a lot of you will discuss that today. And a lot of you put a lot of faith in vitamin B17, and it's certainly a product that should be in every program. It's very easy, it's economic. You can do tablets or injections. Common question is which one is better? Both, if you can do it. If you can't get somebody to inject, you do the tablets. If you can't afford the tablets at around $100 for 3 months supply, then get apricot kernels at $5 to $10 a bag. So you have choices in that. You need to have enzymes and a few things with them, but we'll talk about that later on today. So Joe was really critical, in so much pain. The pain was 150 out of 10, like really pain, and they put him on morphine. And a month before his diagnosis, I went to was invited to a presentation, and Philip Day, who wrote the book Cancer, Why I'm Dying to Know the Truth. I read that book about a month before, and it really opened my eyes. I think it's an amazing book. I don't know whether it's still out there. I haven't heard from Philip Day for 15 years. I think it was about 15 years the last time I met with him at one of the presentations he was doing. A great presenter and researcher, and puts things together in an easy way for you to understand. So he's written a few books, but certainly that one is amazing. And it talks about vitamin B17 and the benefits. So we ordered the product. We ordered a lot because we didn't know anything about it or how much we needed. We ordered tablets and injectable. We ordered it on the 15th. I remember very clearly the dates, and you'll understand why in a minute. So it was ordered on the 15th, and 3 or 4 days later, as we're learning and asking questions about the product, we find out that there's a requirement in Australia that you fill out a specific form, which gives you permission to import any product for an unproven, it's unproven to do what it says it does. And if you're terminal, you're allowed to do that. The process today, despite never having any issues with it, has become more and more complex, I understand. So anyway, we ordered the product on about the 18th, and a week, 10 days later, 2 or 3 days later after we ordered it, we found out we had to get the form filled in and signed by a doctor. So we done that, and the product arrived. We went down to customs to pick it up. Joe was still alive and hanging in there. This was giving him hope, and I think hope is priceless. And those skeptics out there that call it false hope, let me tell you, I've seen people that could not walk were carried into my clinic, and they're alive 10, 15 years later. So hope is priceless. If you take away that, you're taking away oxygen. It's very important. So I went to pick up this product, and just the whole process of the paperwork and everything, I was certainly nervous when I went down to customs because it just seemed like a strange process. But anyway, we walked in to pick up the product, gave them the tracking number, the details, had that letter signed by the doctor for it, and that. And this lady, big woman, comes up and she says, you ordered this? Yes. You ordered it on the 15th, correct? This paperwork is signed on the, for example, the 19th or 20th. Yes. This was dispatched before you had this paper signed. I said, okay. She said, well, that makes it an illegal import. And with that, she took the product in, dropped it in the bin, and said bye. Well, I can't explain to you my blood pressure and anger and frustration at that moment. I was so drained and disappointed that I closed my business. When I told Joe, he chose to turn his morphine up and pass away before we even arrived home. And the level of anger and disappointment and frustration was so high that I dedicated my life into helping people buy B17 correctly, get it into the country correctly, and follow the correct protocols. Because if you don't, you're not going to make it. Like the baking of the cake, if you don't get the formula correct, you're wasting money, time, and energy. And so that was the trigger that sent me on this crazy journey. We opened the largest alternative cancer therapist place in Australia with half a dozen doctors, with naturopath nurses, offering every service under one roof. Physiotherapy, chiropractor. We had a $1.2 million hyperbaric chamber, a very, very professional place. We spent $500,000 fitting out the facility. It was amazing. And that's going back, almost 15, 20 years ago. The clinic was closed down for putting live people on stage, promoting alternative therapies, people who would become cancer-free. So that's why I'm going to show you a video way back when of somebody who I love, and back then he'd done a wonderful testimonial for me, and I stumbled over it in my archives, and I'm going to play that for you today. So I hope you enjoy that. So that's the story. Joe passed away. He inspired me to do something different than the area that I worked in. And it's been a rough road, yes, amazingly rough road, because everybody's trying to stop you having choice. And I think today, all the things happening in the world is giving an awakening to people. You realize now that there are organizations trying to control you and stop you from doing what you're entitled to do. And so I make no claim other than I'm going to give you choice. I spent all these years researching the research and making sure if you're going to do something that you're doing it correctly. And I think that's important. I think that's really, really important. And our spa and medical doctors are chosen because of their commitment to our mission statement, which is on our website, that helps keep them focused. Do we use traditional drugs? Sometimes. We don't have a choice. It's about keeping somebody stable and alive and stress-free long enough to get a result. And stress-free is important. I can't stress that enough. So with that, let's go. So what I'm going to do is go through the next 10 webinars. I'm going to put the images up on the screen, and then I'll discuss them in brief, what I'm going to cover, and it's going to be basically every cancer. But let me just, a couple of questions that I've got. What cancers do we have the best results with? B, and B, breast, bone, and brain. Any cancers above the ribs? What cancers do we have the lowest results with? Advanced colon cancer, small cell cancers. So when you get diagnosed with your cancer, they'll say, is it large cell or small cell? I'm not saying I can't succeed with small cell. What I'm saying is there's very few people who have come and we haven't got results with those. Large cell cancers, we can see, especially if it's fast growing, fist-sized tumors disappear in 20 days, less than 20 days. Bone cancer in 14 days, or like if you've got lumps growing out of your bones, disappear in 14, 21 days. And we get complete results within 3 months. We really push for the 3-month program. Under that, we give a guarantee. I think that's important. So I'll go to that guarantee page if you'd like to know what our guarantee is. I'm going to put you on so you can see what I'm looking at. So, I'm not good with the computers, guys. I'm getting old now. So this is our website, and it's Atlantis-health-retreat.com. And here we have our home page, our services. So when you come here for a wellness program, in addition to the 2-hour medical examination, we check you for everything. We're not only concerned with the cancer, we're concerned with every other problem you've got, because when we're injecting with microphage, and this is important for you, Clara, if there's another area, any area on the body that's got a health issue, the microphage are distracted away from the cancer, so you won't see fast results. So we spend the first 10 days when someone arrives fixing or getting under control or understanding every other problem that's wrong in the body. So that's really important. So this examination checks everything, from your eyes, your teeth, your big toe, your little toe, and everywhere in between. Hyperbaric oxygen therapy accelerates healing. So if you're going to take 6 months to heal bones, you'll heal them in 2 to 3 months with this. It definitely more than halves the time of healing. Colon hydrotherapy. Some people love it, some people don't. Once somebody's done it, we can't get them to stop. So it's 3 times a week. Important. 3 times a week. It's a waste of time doing once. The first time is the only time that it's uncomfortable, because it's like having a medical examination for the prostate or the vagina. It's not something that you look forward to or that you like, but when you have a colonic irrigation, you realize you're really covered up really well. There's only the insertion of the tube and the taking of the tube out. The rest of the time you're covered. It's a closed system, so there's no smell. All your waste product is taken out of your colon in a tube, and it makes for a really enjoyable experience. But the first time, it's something, I don't know whether I want to do this or not. But once you've done it, in the next 24 hours, you feel, I feel so clean and empty, and not bloated and so on. So why do we do colon irrigation? To get toxins out of the body quickly, to alleviate pain, to improve sleep. People who have cancer, not always, but sometimes are on pain medicine. And so that causes them to be constipated. We spend the first 21 days to get rid of their pain, and part of that process is to make them feel good and sleep better. If you're not sleeping, your pain is worse because you don't have the energy to put up with it. You get tired, you get run down, you become exhausted. So it's really, really important that we get you comfortable, we eliminate all the other issues and so on. So colonic irrigation is extremely important. Magnetic pulse removes pain. It's a 10-minute cycle per area. We do three 10-minute cycles every second day. It depends, Clara, if you're blocked up, you just don't feel good. And it doesn't matter what you do for somebody if they're constipated. If you don't have a constipation issue, the health of your colon is really, really important. So your pre and pro bacteria is definitely, I'd say 100%. If you don't get that right, nothing else is going to work. So you're on target there, very, very much. Hi, Melissa, I miss you. Hugs, hugs, kisses, kisses. One of my longest followers online since I've been in Ecuador. So, Melissa, there's a seat waiting for you. We're waiting for you. So that's the colonic irrigation. Magnetic pulse is basically it's a ring that we put on different parts of your body, and it causes your body to shake, your muscles to contract, increases circulation as a result of those contractions, reduces pain in joints, increases the amount of product. So we do that before hyperbaric, and sometimes we do it before an IV to increase the circulation into the area, to increase the product that arrives in that area. So we have over 101 different combinations of IV therapies. So in addition to the cancer therapies, we will do one or two other IVs, which are to work on all of the things we observe. So when I say observe, everybody has different things going on in this journey. So somebody might be stressing, somebody might be lacking energy, some people may have pain, some people's pancreas enzymes may be high, their liver may be struggling with the overload of the toxins being released. So we do liver support, we do a whole lot of things. And these are so important because if you're only doing the cancer therapy and not addressing these other things, you'll be spending a year fighting this cancer or more. You can do like the testimonial I'm going to play for you later of Graham. He was 18 months and all signs of the cancer were gone. This is chemotherapy and non-Hodgkins Lymphoma. 18 months. Like, wow. Tough guy, yes? And then within 3 weeks after, all of the lumps grew back within 3 weeks to the same size as when he started. Went and saw the oncologist, and he said, "Oh, the good thing is we know how to get rid of it. We just start the same thing." So things need to be changed and modified. Cancer's smart. Like, cancer's really, really smart. It works out what you're doing. So we don't start everything at once. We start one thing, add another, come in from this direction, that direction, inject around it. So important. Therapeutic massage to relieve pain, to make you feel good, to relax, important. So we have massage available. We have a thumper massage, which if you've ever experienced that, it's better than any other massage, certainly before and after. All I can say, if you've ever had a really tough steak and a really tender steak, this tenderizes your whole body. And it vibrates so quickly that it just relieves stress. It feels amazing. We're due to order a new one of those. So the one we've got is 10 years old. So I do need to get a new one. Ultrasound, we can monitor in the clinic. We have an ultrasound machine. We don't offer external ultrasound to people. Echography, they call it in Spanish, echography. We don't offer this to the street. It's only to monitor what we're doing. It's to monitor if we can see a tumor. We can look at it with our ultrasound. When we're doing your markers, so sending you out for blood tests, ultrasound, CT scans, PET scans, we get them done by a professional that does a report, so you have them to show your doctors when you return. We also need it like that for evidence, because we like to be able to say, okay, this is where it was, this is where it is, by outside people that have no relationship to us. Blood tests are extremely important. Now, when you're doing a home program, it's very difficult to get these as often as we do them. We do them almost every week, especially at the start. Our goal is to get everything within range, to get your vitamin D levels for the GCMAF up to the highest end, even breaking through the top is fine. As long as you're having calcium K2. Important. Why? Because if you have too much vitamin D and don't have calcium K2, you get bone growths happening in different places from too much vitamin D. Everybody should be taking a vitamin D supplement and measuring their vitamin D annually. Everybody should do blood tests every year for cancer, all of your markers. You can't do that at home on your insurance. You need to have a holiday overseas. Come to Ecuador. We'll get all of them done in our program and do a full assessment. Then you have a nice holiday. And if you find something, you can address it early before you have any symptoms. Echography to check your heart is regular and healthy. We've had half a dozen people pre-heart attack stage in our clinic in the last year. Really important to do these things before you have symptoms. Half of these people said they're going on a vacation and traveling to US, don't feel 100%. And we found blockages in their heart. So 14 days of IV for two of them and double that for another person, completely cleared their veins, improved their echo results, and they enjoyed a nice holiday and came back to do it again afterwards because they felt rejuvenated. They felt like we'd taken 10 to 20 years off their life. Live blood viewing. The biggest benefit of this, I like people say, how do you know if the GCMAF is working? You can get a nagalase test in some places, but I don't trust it because your blood is either flown to the other side of your country or flown overseas. And I just don't trust the results of those because they can vary so much in people. The best thing, and you can get this done everywhere in England, US, Australia, New Zealand, France, Germany, live blood viewing or live blood analysis. They made it against the law, I think, in Australia to call it analysis. So anyway, live blood viewing. Now, you can see your microphage. In fact, you can see that you don't have microphage when you first come to our clinic. And then within 7 days of having the injections, you see the microphage crawling around in your blood. You also see such an improvement. Your sticky cells have gone, the shapes of your cells. Within 21 days, every fault that we see in your live blood viewing is gone. So I love the advantage of you, the patient, seeing that. We video those and you get to take them. This page on the website is takes you to the last 3 videos, which you can also see on YouTube. So these are all the scheduled ones. So this video that you're watching now will be edited and uploaded onto YouTube, and they'll also be posted on this site. So that's the service link that I just finished showing you. I hope you enjoy that. The next link is Fight Cancer. Here we have details of GCMAF. A lot of this is research, so people say, what is this? Why I haven't heard of it? Well, it's really technical, the information, and it's all on there. So GCMAF reactivates your own immune system to fight the cancer and everything that's wrong in your body. People with cancer should be on GCMAF. We gave away, I think, 6 bottles to people last year to protect their health and to keep them strong. And, we from a distance, we're not always with you, but we're with you in spirit. And we want you to fight this thing, and we want you to make it, and we're here for you. So we'll be giving away more of that over this year. I've got 6 bottles aligned to give away over the next, 8 bottles to give away over the next 8. All the webinars that are booked in, there's going to be 1 bottle given away. So make sure you're online, and make sure you share this video to your friends. So because it's quite an expensive product, a high-end product. High pH therapy, without question, is the most powerful therapy on the planet. It's my therapy. I learn from other people. They're not with us anymore. If they are, they're over 100 years old. Keith Brewer started the research on this. He's a scientist from US. He founded the Brewer's Library, and so you can find that online. It's evolved from his research. 20 years, you don't do the same thing and expect not to improve results. So I've been working on this for so long. It's 20 minerals now. It includes gold, copper, and zinc, silver, and it's a 1 hour IV that needs to be done 7 to 10 days. Sometimes we get to 14 days, and you hit a brick wall where your body can't handle anymore. After and on the 7th day, our Lord's number 7, yes? The 7th day onwards, you see cancer shrink like never before. If you've got spine cancer with lumps growing out the back, breast cancer, you feel it shrinking. It's like mind-blowing. It's so exciting. And it works and complements your own macrophages, the GCMAF, that accelerate. They see broken parts, and they get in and get deeper into the tumor. And so together they're 100 times stronger. And there is, on its own, nothing stronger than high pH therapy for cancer. Ozone therapy in the blood, injected into the area, into the joints, amazing. We don't do it on every client. Depends on how things are going and where it's appropriate. But an amazing therapy. Ozone steals an electron to become oxygen. It's an unbalanced oxygen molecule. And the process of stealing the electron, it kills whatever it steals from. You can put ozone directly onto your hands, and it doesn't do anything. You put it onto a plastic glove, it'll eat a hole in it. Like you can actually watch the hole being formed on the glove. So it does the same with a tumor. If it comes in contact with a tumor, it doesn't have the protection your normal cells have. And so it actually steals an electron and bursts that cell and kills it. So I love ozone. Vitamin B17 Laetrile, we're going to talk about all of these a little bit more later in the home program. And then I've got some more specific details on the bottom of this page. We're going to add to this. There's only so many hours in the day. Breast cancer, bone cancer, metastasized cancer, prostate cancer, lung cancer, and information on what we would recommend as a good diet. Again, the video page with all of our videos. So that's that link. So those that just tuned in, I'm giving everyone a quick run over our website. Here's more information on GCMAF. GCMAF is not only for cancer. High pH therapy is only for cancer. The GCMAF is for so many things. So, in fact, if I click on this, it'll have a list here. I'll show you, I think. I like a short website that just gets to the point, yeah? But we had a lot of people say, oh, where's the research? So this you can see everywhere here. Everything is linked to a government site that gives you the information on this. So to me, it's too much information, but I prefer my webinar. I hope you like the fact that the webinar is to the point. Anyway, so all autoimmune diseases, so cancers that Epstein virus, hepatitis B, herpes, hepatitis C, multiple sclerosis, urinary tract infection, autism. It's, in fact, for autism, it's had a lot of controversy, but 90% of the kids with autism see improvement, according to the doctors and researchers I've worked with. We have an autism program now, so I may get into that a little later on. Rheumatoid arthritis and so on. So please go to the page, have a look through there. And people who do a wellness program, which is 2 weeks, week off, 2 weeks, doesn't matter what we're doing, we use GCMAF injections. So that's that page. So GCMAF research, GCMAF for autism, autism home program, GCMAF autism stories, GCMAF diet, the GCMAF home program for autism. A lot on autism because autism falls into two categories. The elderly people with autism, when I done some posting about this, I never had so many negative comments in my life because they don't believe they have a problem, and that's okay. Freedom of speech. And so for them, I apologize. For somebody who's had a child that's lovely and perfect and normal, and then had an immunization and seen major changes, and they call that autism, GCMAF may be able to help you, and it doesn't matter. And for those in England, when I started on this journey, I was with autism. I was told I believed that it wouldn't help an elderly person, but it does. It does. The results are the same in elderly or newly diagnosed. So, and at the end of this video, and it's only for the next month. So if you're looking at this video past February, this office will not be available. But we're doing a really reduced price for people that want to come here and do an autism program. Like, it's ridiculous. It's just covering our out-of-pockets. And so keep an eye out for those details at the end of this video. Then there's the Contact Us page. I think that's pretty clear. And please send your details on the email address, and I'll call you back. If you call me and I'm with somebody, we have to set up a time after that. So, okay, so that's the website. Then down the bottom of every page, information on Atlantis. So here you find out about us, why choose Atlantis, our guarantee. I was going to cover that earlier, our guarantee. Really, really important. We're the only facility that offer a guarantee that if you do our 3-month program and the cancer is on its way out, and we feel that it's going to be beneficial, you can stay for as little as $7,750 and continue. You can go home and come back and continue. If that cancer ever returns in 1 or 2 years' time, you don't have to have a large out-of-pocket. You can come for $7,750. Why? Because you become family, and we care about you, and we understand it's expensive to beat this thing. It costs a lot of money in products and our time and energy, and so we want to give you that assurance that we're here. Follow the home program after you leave. 3 months must be done at home intensively to keep it away. Even if they tell you you have no cancer, you must continue for 3 months. There are cells there that they cannot see, and you cannot trust them. And so stick to the home program intensively. And if you have a little bit left, let's say you had never happens. Our bone cancer is the most amazing, but let's say you had all your spine was bone cancer, and there's one little bit left, and it just didn't want to go away. Doesn't happen with bone cancer, but anyway, and let's say you chose to do something like a little spot of radiation on that. Continue to do the home program before and after that. If you want to have surgery, let's say you got a little lump in the breast, do the program at home right up to surgery. No products for 3 days after surgery, then hit it intensively for the next 3 months. Cancer is a healing crisis, so if you have a cancer removed, you need to make sure, A, that heals properly, and 2, any cells that escaped are destroyed. And the products we give you to do at home are for that reason, and so important. I can't stress enough The people that I've seen say it's not important, they told me they got rid of it all. Please, please don't rely on that. Don't rely on that. It's really stressfully, I can't tell you enough. Don't rely on it. Always, always understand that this thing is hiding. It's a little time bomb trying to trick you and trying to trick everyone. It immutates, like, if you have prostate cancer, it's moved to the bone. They do a sample. How do they know it was prostate cancer? Because it's prostate cells growing there. These things mimic other areas. They're smart. And so, please, continue to do the program at home. 2 weeks, week rest. 2 weeks, week rest. 2 weeks, week rest for 3 months after you're clear of cancer. And then for 2 weeks, week off, 2 weeks every year for the rest of your life on the anniversary that the cancer went away. But if it does come back, we have a guarantee, the only one that puts things in writing, that you can come back here. Our mission statement, the apartments that you're staying at the moment until our new facility is built are absolutely beautiful. You have nice views. And yes, you're in a holiday location. It's sunny today and sometimes overcast. It's not raining and not cold. It's beautiful. So there's some details there where you stay. All of the apartments have 2 or 3 rooms. So you have friends visit you. If you're looking after yourself food-wise, there's no additional cost. If we're supplying food for other people, there is additional costs. That link there takes you to the consultation forms. So if you'd like our help, fill out the consultation forms. These 2 are English, these 2 are in Spanish. And then email me all of your information. Consultations form. We specialize in metabolic disease, and a lot of people say, what is metabolic disease? So that page explains it in detail. Metabolic diseases are diseases you can't give to somebody else. They happen as a result of diet or nutritional deficiencies or poison from the environment, like mobile phones, electromagnetic currents, and so on. So important. And a little bit of encouragement and understanding determination. I'll be covering that in a lot in one of the videos upcoming. So then a mission statement about us, why Atlantis, and our guarantee, just extra links to those important things. Okay, so some question times. So please write any questions you can think of at the moment that you'd like me to cover. And then what I'm going to do is cover a subject, the next 10 webinars, images, and explain to you a couple of minutes about each of those, why, when, how we use them, and so on. So, Melissa, a long time since I've been live. It's been a busy 3 months. Been busy, busy, busy. Let me tell you. We had the challenging times that all of you had with this lockdown. We were locked down for 7 months, and then we had a waiting list. So we've just been so busy. I haven't had time to get online. So we caught up on the backlog, helped a lot of people, and now 2 people every 3 weeks is our quota for this year. If the new facility is finished soon, we will increase that. But with lockdowns and all the things going on, I'm not going to promise a time. You've been busy too, Melissa. That's good. Okay, another person asks, where are we located? So, Salenda, hello, welcome. First time I've seen you online. I have a little place I work from in Florida where we ship supplies out to people in the USA. I have supplies in Australia, and I have some supplies in England for people doing the home program. So that's as far as helping people on the home program. Our facility is a 4 to 5 hour flight from Florida or Texas on the coast of Ecuador. Let me look for some little video to show you. So it's a beautiful country area. So let me show you a video on that. So that is our location. So if you enjoyed that, back to me. There we go. Okay, so so that's the beautiful place we are in, and we're looking at another. We're involved in another place that will have 30 rooms, a hotel right on the ocean. So things are happening. Good things. So, okay, so that was that question answered for that lady who wanted to know where we're located. So that's a 4-hour flight from anywhere in the bottom of the U.S. You can fly to us. England and other countries, Muslim countries, usually fly into Bogota, Colombia, or on the border of U.S. Mexico, and then come to here. Australia flies into it's a long flight for my Aussie friends. That's why I won't be back. So you can. I'm sorry, I will not be back. It's a long flight. So it's about 18. It's a good flight. It's like non-stop. So you go to sleep, you wake up, and you're in a new location. Chilling, and then chilling, and then you sleep. Then you have either a night there or 6 hours stopover, and then you fly directly to here. So I'm not sure of the hours from England, but when we have clients here from England, they have friends flying in and out. So good thing at the moment, the flights are so cheap. The ones that I've looked at, Canada, people fly here from Canada. It's like $400, under $1,000 return from Canada. I often get asked what what countries have we had people come from? We've had people from every continent and almost every nationality. So, and it's difficult working through translator, let me tell you. But we manage. My staff, all bar one, speaks English, and he's in the background more than he's working with you. All the staff and the doctors speak perfect English, so that's a really important thing and a good thing when you're coming to a strange country. So, okay. Now, let's go through these upcoming webinars. Did I answer all of your questions? Let me look. I miss you too, Melissa. Good question, Clara. All of the external research says that you only need to have it orally. But my research, my hands-on experiences, no, there's a major difference. So let's understand the process. Macrophages go to wherever there's a problem. Your body. So let's say you get bitten by a mosquito bite, something simple like a mosquito bite. What happens? Your body gets itchy. You scratch. The process of the combination sends a signal that there's a problem there. The macrophage move in. Yes? An area of sudden pain. Macrophage move in. If you sprain your ankle, 3 days later you see all that yellow buildup. That's dead macrophage or macrophage that are overwhelmed at cleaning up material and being absorbed back into your body as a protein. So they've eaten the damaged material. When you have sinus, phlegm coming out, it's the result of the macrophage overwhelmed and absorbed all the waste and bringing it out of your body. So, do you have to inject in the area? Let me tell you clearly. Yes. Yes. And so let's talk about how that's done. No, let's talk about the process of that. So I've had a lot of women with breast cancer and really, really high success. The few that didn't have success, the cancer was so small they could have it removed with surgery. So we're talking fist-sized tumor or the whole breast tumor. More often the cases I get, the cancer is metastasized to the bone. So anyway, oral, in my product, 0.2 mil. I give 10 times the dose. You might say, well, it's expensive to do that. Well, it's expensive not to do it. So 0.2 mil of my product is a recommended dose on all the research. You need to put 0.2 mil oral. That's what they say. What I do is a dose in the location, a dose orally, a dose everywhere else there's a problem. Sore lower backs, all women without exception that have breast cancer have their back out or back problem in and around their bra strap. All men without exception that have prostate cancer have lower back problem or very lower back pain, especially when you use the magnetic pulse. Wherever you put it on, they might not know, but they suddenly feel pain. And that's because there's an injury there from many years ago. And sorry, I got to click this to view comments. So you're confirming that, Melissa. You have pain in the area. So lung cancer, the back is out in that area. So you need maybe. So let me go back. I'm going back now. What I used to teach people 15, 16, 17 years ago. We used to have cancer workshops every Sunday. I miss them so much. We should do them virtual, yes? We should do virtual cancer workshops once a month. Okay, so I recommend the massage, physio, chiropractor, but a good one. Don't just go to any chiropractor. You need one that spends 30 minutes to an hour with you, not one that does the wham bam, thank you ma'am, 3 to 6 minutes, next patient please. No. And I'm not saying they can do a good job doing that. But if you potentially have cancer in that area, it's a problem. So you do not want them. You do not want them doing quick adjustments on you. You want them to be gentle, thorough, and so on. So we have all of those services here. So all of your nerves travel down your spine and then around to the organs. If the information isn't getting out of that vertebrae to your organ, it may be one reason why you have cancer. And it's usually more than one reason, but this can be a contributing factor. So let me give you an example. If I put my hands around your neck and choke you, it's one reason why you might die. It's one reason why that organ isn't healing properly. It's because the information and, even the signals from, hey, microphage, I need you to get into my lungs to fix a problem. If your back is out, the information doesn't get there. So really important, really important. Get it adjusted, get physio, get massage, and inject with microphage. And Australian man doing the home program, 4 vertebrae have cancer, has lung cancer, and rib cancer. So he was told he would be a paraplegic within 2 months if he didn't do chemotherapy, radiation. So he took a risk and started my home program, but was very scared. And that's fine. It's those of you who are in the journey of cancer know that you're face to face with a doctor, oncologist saying to you, hey, you have to do this or you're going to be a paraplegic. Now that's scary, and everyone can understand that. So my goal is to get you to have faith in whatever you do. Whatever you choose, you put the blinkers on and go hard at it. So this man done my program, and he was due on the 6th week, I think, to have a CT scan. So he went in, he had to see the oncologist. Why until after, I don't know, but he saw the oncologist again, scaring him. Went and done the CT scan, and when he saw the oncologist said, you have to start chemotherapy. You've got weeks before you're a paraplegic. He didn't even see the results yet. Anyway, he started chemotherapy. Anyway, when the results of the scan came back, all of the bone cancer was gone. Not the rib cancer was still there, the lung cancer was still there. He's doing it orally and injecting in the spine. What I said to him is pick the worst spine area and inject like a dice on all of those 4. Don't do the other areas. Why? You only have 1,000 or 1,000,000 or a certain number of microphage. If you try to get them to go to 10 different locations, there's only going to be 50 in each location. And you need to fix the strongest and the worst spot first. So I said, do the spine, because his biggest risk was not a rib breaking. It's not going to cause a problem. His lung was small. It was not a problem. But the back was definitely a problem. Anyway, he done 6 weeks of that, approximately 6 weeks of that before the scan. And that cancer was completely gone. It's doing it at home. Amazing. So that was my first success with the GCMAF, and I fell in love with it then. But everyone said to me, you don't need to inject locally. So if I didn't inject locally, why didn't his rib cancer or his lung improve? So, and who wants to experiment and do 2 vertebrae and not do the other 2? So we done them all. So the injections helped in that area. This is a sad story I've shared with you before. He started chemotherapy, done chemotherapy after that. I said to him, it's a waste of time using the GCMAF and chemotherapy. Save your money and use it when you're finished. He rang me up a year later on chemotherapy. This is really powerful, probably the most powerful thing I'm going to tell you on this webinar for practitioners. He came back to me with cancer in every vertebrae except for the 4 vertebrae we injected. There was no cancer in those. So the GCMAF not only cured them, and I've got all of the x-rays. I wrote you'll find online a book I wrote about this story. It not only protected them, it didn't come back to those vertiges. Would have been to inject in the rib and to nebulize into the lung in that case. So the client you're working with at the moment, I would be doing 3 days a week. I would nebulize, I would inject the spine, get all the other areas healthy, and then I would start on the breast and put all the effort into the breast. Make sure the spine and everywhere else is fixed first, because if that information is not getting through, it's not going to, you're not going to get as good results. So I hope that answers your question. Did that answer your question? Okie dokie. 1 hour. Yes, alignment is very important. Okay, I think I've answered most of your questions. There was another question that got emailed to me. Somebody asked me about diet. So we've been an hour. I'm going to go a bit longer. I hope you're okay with that. Am I boring anybody? Give me a thumbs up, like the video before you forget. One die size. So what do we, yes. So on the spine, yes. In the area where the person has the problem, I would put 0.5 mil and inject around that spine. Bang, 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 bang. If they've got 5 locations, I would use 1 mil in all of those locations. But focus on the worst one first. So if I give you a kick in the backside, you've got a bruise there. So if you've got cancer of the breast and a bruise on the backside, the cancer is not causing any pain. So the kick in the backside is going to distract all of your macrophage to that area. It doesn't matter what you do. So for those that don't know, macrophage, they're the natural things inside your body that repair things. They're the first line of defense. If they get overwhelmed, they call other cells, your white cells, and turn on the other parts of your immune system. Your macrophage are put to sleep as a result of nagalase, which is in all of the injections, or all of the preservatives, all of the immunizations, all have nagalase in it. It puts your immune system to sleep. So cancer gives off nagalase, puts your immune system to sleep. They put it into injections. Why? It's to stop your immune system overreacting, so that the process of the sample of the virus or whatever they're injecting into you can have a chance to get inside properly, and then your white blood cells get to it. But they're turning off your immune system, and the problem is it doesn't turn back on. They're using aluminium in these things. Now, the aluminium bonds with other micro ingredients and gets carried to the brain. Aluminium can move into the brain, causing inflammation. All of your kids' behavioral problems are a result of that. All of them are a result of that, without question. You add the immunization, the number of kids have in, and then all of the food ingredients, all of the additives. These are the reasons autism exists today. It didn't exist. We didn't see it before in the 60s. This is the words are just not. My video would be banned if I told you what I thought. When you fix these underlying problems, when you give a child some IV vitamin C and you give them GCMAF and the powerful anti-inflammatory in the spine, these symptoms disappear. Unbelievable. So anyway, I get angry because I see all of these things as preventable in children, and it just upsets me. Okay, so yes, in the breast, let me give you the good news. It doesn't hurt. Like, it's a diabetic needle. Doesn't matter where you put it. Very rarely do people have any pain. I do 2 things. I put, when the client arrives, we put DMSO on the area that we're going to inject. Then we do other things, and then when we come to injecting in that area, we put again DMSO on the area, and in addition to DMSO, we put a product to numb the area. But we didn't always do that, and people never complained about the pain anyway. But and I've injected myself live online, showing people how easy it is. And some of my past videos, you see, I say to a client, he says, I don't know how to inject my brother. I said, okay, inject me. They done it. You know, it's not even a mosquito bite. So yes, that's what I do in the area to increase the comfort of the client. The less stress you have. So finding the right practitioner should remove all stress. You should have confidence with them, move forward with that confidence, and as a result, you're not stressing. So what, Clary, you've also made me think of another question that nobody asked, but nobody could ask this question because it's just an observation. All people with cancer. Now, I used to only say women. How terrible is that? But all. Why is my change? Because in Australia, people came to us and went home, and so I only saw them for that time. But now they're flying from overseas, and we're seeing them a lot. Flight syndrome. I call it flight syndrome. I wrote a paper on it, I don't know, 10 years ago. It's so true, and it's almost in everyone. It's an adrenaline rush that the people, and you'll see it with breast cancer, you'll see it with prostate, you'll see it with all. So I'm going to touch now on the mind and cancer. So we all know what adrenaline is. For those that don't, it gives you energy. So it gives you energy to run fast. If the tiger's coming after you, you run. You know, people who have lifted a car off somebody because they had this adrenaline burst when they were in shock of something, and all of their energy became so powerful. So that's adrenaline that does that. So people with cancer, almost all, unless their cancer is caused by a chemical. So in other words, if your cancer is caused by DDT, chemical that's being sprayed, you were spraying it and you got a cancer as a result of that. Commonly lymphoma. All other people suffer from flight syndrome, which is you say something to, oh really, is that mine? Do I have that? No, you don't have. Oh, I thought you were talking about me. They have this adrenaline rush, and that can happen from you talking to them, or that can just happen if somebody opens the door suddenly, or they hear a knock. You're sitting there relaxed at a meal, and somebody will say something. Does that apply to me? They have this flight syndrome, which is an adrenal rush. You can see it if you're with the people 24 hours a day. Now, it's more obvious in women. Well, I observed it in the women more in Australia. But people were only there, they weren't with us 24 hours a day. So when people are with us 24 hours a day, you see more, and you can help them with more. And so that is really important, that you look at the mental issues and you help them address the underlying. You make them aware of it. If you make them aware on it, they can calm themselves and be aware of that. When I had my injury, some of you know I had a CT scan injection and was hospitalized for 6 weeks, nearly died twice, and had ongoing pain from that. From that injection, I got a whole lot of, I felt the adrenal, so my body was so exhausted that I felt the adrenal rush. Watching movies, I was laid up in bed, so I'm watching research, and then to give my brain a rest, I'd watch a movie. And so if somebody fell off a horse, or fell off a motorbike, or I had this adrenaline rush. And because I was aware of it, I could work on it. But it wouldn't matter. If I'm watching the same thing, I'm not scared of it. Like I would watch somebody fall, I could rewind it and play it again, and the adrenal rush would keep happening. This happens in people with cancer. You can observe it if you're aware of it, and you can help them work on that and be calm. And it's priceless, because I think that makes cancer grow. And I think that's a trigger for the mind part of cancer, which is really important, that it needs fixing. The other thing is you will find in more than 90% of cases, the left breast, yeah, and that's what our job is, to let them know that cancer is not a death sentence. Cancer is not a death sentence. When they give up on you, and if your cancer is metastasized, they can't help you. Come and find a practitioner that will work with you, help you do alternatives safely, and give yourself a fighting chance. Okay, so let me discuss with you. I've read the books. You've probably read the books about minded cancer. Let me tell you what I've observed. Left breast. So first of all, you clap your hands, and the hand on the top tells you whether you're left or right-handed. The left breast, loss of a child, if you're right-handed. The right breast to do with abuse of some sort, and that abuse could be to you, and it also could be from your mother. You've absorbed it from birth. We do carry memory from our parents. Pancreatic cancer, no control. It's in your center. You've got no control over your life. Prostate cancer can be chemical, and it can be past abuse. Usually sexually related. And let me just tell you, there's GCMAF and a combination of 6 other ingredients. I get people with prostate cancer to inject into their rectum. It gets directly onto the prostate, just like injecting correctly onto the breast. So you do a colonics, or you do a coffee enema, or you do a water enema. You clean yourself out, you wait an hour, and then you put this 30 ml of fluid into the rectum. Get straight into the blood system. Amazing at accelerating results. But 50% of men with prostate cancer won't do it. Like, die or do this. No, I'm not putting something in my anus. So definitely a psychological issue there, because like it's a tiny tube, less than a quarter of an inch, a syringe, and it's just a quick squirt, and that's it. It stays inside, and it's really simple. Women go through lives having invasive examinations, but some men it's a problem. It's a real problem, and it was the biggest shock I had in this industry was with prostate. I far prefer somebody who's had I don't recommend it, but if you've had your prostate removed and you've got bone cancer, it's much easier, because you don't have to do the main thing. An important part of getting rid of the primary is doing that infusion, and 50% of men will refuse. Okay, so good question. I think I answered the question. So I was going through the different areas of cancers. The next question I get, and I covered it before, but really high success with brain cancers, mouth, bone, and all breast, above the rib. Pancreatic cancer, if it hasn't metastasized, amazing. 10% per week shrinkage. More than 10% shrinkage per week. But if it's metastasized, it depends. If it's blown out all inside your lining of your stomach and that, no. It's very, very tough, because what happens in those cases, and in all cases, if you have edema, the edema needs to be under control. Otherwise, it's not worth traveling a long way to work on that. You're better off doing a home program, getting rid of the edema, getting stronger, and seeing the cancer going, and then coming here. But if you do not have edema, your chances are very, very high. Edema would be the biggest thing to interfere with results. So we covered stress, we covered the mind, we covered a lot of things. The next thing I'll touch on is diet and daily routine. It's so important to have a routine. Why? because your body likes it. It likes to go to bed at the same time. You get in a habit of the same time, you sleep better. So routine. Dinners at the same time, sleep at the same time. I like fasting. I like to have my lunch at 3 o'clock in the afternoon. Then I'll eat at 6 o'clock, and I'm in bed between 8 and 9 o'clock. That's my routine. Healthier, stronger, thinking clearly, up bright and early. 5, 6 o'clock, I'm ready for a day's work. Go to bed at midnight, feel lousy most of the morning. So that's me. You may be different, but routine, whatever your preferred routine is, do a routine. Even if you're home and they've told you you're going to die, I tell you don't have to die. You can fight on, but get to a routine, because you don't know if you're getting worse or getting better if you decide to sit up till midnight watching movies, or people keep visiting you after work at 7 o'clock and staying till 11 because they've been told you're going to die and they're going to hang around and spend as much time with you. It's called they love you. They love you to death, and they're loving you to death because you need your sleep, you need your routine. So what I tell people to do is tell their friends that, listen, my day off is Sunday. I can eat anything I want. I can do anything I want. After your first 21 days, I say to people, have a complete relaxed day. The routine after 21 days, you shouldn't be missing cakes and chocolate or whatever. But have a day when you have a little bit of whatever you like to eliminate stress. And just like a woman has a baby and craves dark chocolate, how many ladies crave something? Who thinks your brain is stupid? Yes. If you're pregnant and you're craving something, maybe your body knows that there's an ingredient in that, or it needs what is in that chocolate, or that Vegemite, or those peanuts, or whatever. It knows there's an ingredient in there that it needs to make something that's inside that baby, or that you're lacking because your baby's taking that from your body. The craving happens for a reason. So if you're craving something during the week on a strict program, whatever program or diet you've chosen, or do it following my recommendation, the day off is you have that. If you still desire it on the day off, don't just have it, on Tuesday and Thursday I desire dark chocolate. Well, I wouldn't eliminate dark chocolate. I think it's good for you, especially if you have a hormone-related cancer. I don't have a problem with that. But let's say you desired some sugary item. Have a little bit of it on the day off. And the last thing on diet, I really like the Eat to Your Blood Type diet. I think it's amazing. I think also the things to avoid are most important on that diet. So if you're having a strict diet, whatever diet you've chosen, go to eat to the blood type diet. I think it's really important. Bye, Clara. Thanks for joining us today. See you on Wednesday is the next webinar. Okay, so now I'm just going to play a video if I can. And while the video's playing, can you tell me, guys, if you can hear this? Okay, I'm going to add that onto the YouTube one. So, okie dokie. Okay, so in the coming weeks, we're going to have a video on the Cancer Attack Pack, the home program for people. We're going to specifically have a detailed presentation on bone cancer. Treating breast cancer naturally and the special things you need to do different for breast cancer. And in that, we'll also cover bone cancer and brain cancer. IPH cesium therapy will be covered also. GCMAF therapy. Which therapy is the best? vitamin B17. Special details on what you have to do for metastasized cancer. Okay, so that concludes my presentation for today. Went a little bit longer than expected, and I hope you enjoyed it. I have 4 videos, some testimonials on that, and some funny ones. You want to see a funny video? A funny image? This lovely lady, can you see her? She's still working at 80 years old. Beautiful. I met her in a pathology location. I'm also going to do some cooking videos this year. So so we'll have some fun with that. I've got these videos I wanted to show you, but if you can't hear the sound, it's no good, so I won't be able to play them. Here's the scene of outside of our clinic when you're doing IV. You get to watch the ocean. This is during the pandemic. Now that the pandemic's over, you can watch some people in people in their bikinis. There's my daughter doing live blood analysis training. There's one of our supporters who like to take people out for lunch when you come and visit here. There they are again, Linda and Susie. I don't know what image is coming up next. So, oh, there's my daughter. Clients having fun in the spa. Okay, so that's about it. I'll sign off with a God bless you. This week I'm free to help people with consultations from 10 o'clock to 5 o'clock. It's unusual, but I've got a week where I'm staying at home in the office. A couple of people that are home will be able to, the nurses and doctors will look after them. So 10 till 2, email us from the website and let's book in a time to see if we can help you. I don't think you'll find anyone that will fight harder than we'll fight for you, or one of my supporting doctors out there that are helping you with the best they can with the tools they've got in your country. Whatever you do, put on the blinkers and give yourself a fighting chance. God bless, signing off, and bye for now. Don't forget to like and to subscribe.
Yeah, okay. My name's Graham Jenkins. I came to the RONA program in October last year after 16 months of chemotherapy that was treating me for 2 cancers. I was unlucky enough to be diagnosed with leukemia and Non-Hodgkins Lymphoma. So I went through 16 months of treatment. I was told I was in full remission and asked to go along and do stem cell collection because the odds were that I would get it back again, and when it comes back it's very aggressive. So I agreed to do that, and during the process of having stem cell collection I was to needle myself with a growth stimulating factor to stimulate stem cell growth in the bone marrow. And I'm convinced that the stimulating factor actually started the tumours growing again, because within about 3 weeks I had large tumours popping out of my neck and out of my groin, and so I knew I was in for another battle. So I went back to the oncologist and he said, well, there's no point in mucking around, we just need to get straight back into chemotherapy. And I thought about that and I thought, no way. I thought, I've had 16 months of it, what are you offering? He said, well, we'll just go back into the same treatment. I said, no, thank you, I'm going to go and look elsewhere. So during that 16 months, I done some research And I found alternatives on the internet that scientifically proven that they worked. So I set about then trying to find out if I could get that treatment in Australia, and at the time I could not find that, so I was looking at going overseas to have it done. And by a pure chance on the internet I've come across Paul Rayner, and was actually the first person to walk into the clinics when it opened in October last year. So I started the program immediately in October, and by a week before Christmas I had no tumours, no pain, all gone. It's been a really interesting journey because I've learned so much about myself and my body, and just the fact that I had a choice to make the decision to go alternative was a big thing for me, because I felt I really didn't have much of an option to go back orthodox without, and still have a chance to live a reasonably good lifespan. So for me it's worked. Excellent. I thank Paul for that. And I enjoyed the program so much. I've enjoyed being in the man's company and everyone that works for him, that I've decided to join the company. So I now work for Paul, and I'm finding that very, very rewarding, and I'm very happy with the situation I'm in at the moment. Well, thank you all for coming along and taking the opportunity to listen.